12. Counselling on issues related to the ultimate concerns. Life's greatest crisis is death. Death does to marriage what God allows no man to do. It puts asunder. When that happens, grief is imminent as a painful crisis. Marriage makes of a man and a woman one flesh. Death tears the flesh in two, and through the loss of one to death, leaves the other a mere remnant of a person. That experience of fragmentation is known to us as grief. That is directly quoted from the book. That is grief. Okay? The definition of bereavement. The manner of reaction towards death is the case of one here to you is called grief or bereavement. This is an anxiety over a significant loss with a destructive force of violence in its attack and grim, unattractively in its persistency. This loss will be felt for a long time. Okay, that is a feeling of, you will never see that person again. It's a heart sore. It's actually, as they say here, it's violence. It's a violent feeling of a loss. And I think all of us experienced that already. Okay? Symptoms of bereavement, or bereavement, or however they pronounce it. There are physical and emotional symptoms or manifestations. Severe symptoms of grief come from 10 days to 2 weeks after a tragedy. Then it actually strikes you. Okay, this is really happening, because then is when you start missing the person. Because you can still, a week or two, you can still adapt that you didn't see the person, but now suddenly you actually start to belong to the person that longing. Okay? Physical symptoms are the feeling of tightness of the throat, choking with shortness of breath, sighing or empty feeling in his abdomen, lack of muscular power. You got that feeling of, I feel empty. That is mostly that thing, okay? Respiratory breathing, disturbances come when people are encouraged to talk about their loss. No appetite, food has no flavor, food tastes like sand. Freud makes studies of grief reactions. So Freud is a very known psychologist, and he actually, if you read his books, you will say this individual is got everything, all actions onto a sexual and a developmental way, and I think there's a lot of us that will not agree with everything he says. Okay, and as time went by, and other psychologists, psychiatrists, and all those people, scientists develop, and they see other things that wasn't seen at Freud's time, but he's a known person. Okay. And enumerates emotional features of grief as a profound, painful dejection, the abrogation of interest in the outside world, the loss of capacity to love, and imitation of all activity. There's also a quote from the book. Okay, the purpose of grief. People are disturbed during the process of grief because they have little control over the expression of their emotions. You go through emotional stages. The one day you feel fine, the next day you totally, you're going to a zigzag through the emotional stages, and you do not have control over that. The fear of losing the mind is present. It depends on how great your grief is, what's the situation. And some force themselves to hold back the tears, or they would like to let them go. And that is the most wrong thing you can do, is to keep back your tears. If you want to cry, you cry. Okay? Through this experience, a person will disengage himself from the demanding relationship that has existed, and reinvest his emotional capital in new and productive directions for the health and welfare of his future life and society. So you must actually help that person to go on in another way without the person that was there all the time. Whenever stamina of grief, disappointment, anger, or overwhelming joy exceed the tolerance of the organism, the ensuing state of tension is elevated by the release of energy from various organs and organ systems which abolish the tension. It's also a direct quote from the book, okay, from the manuals. Now we look at the normal process of grief. Jackson states that the grief reaction may condition in 4 ways. By the personality structure of the individual, in other words, what type of personality the person is, a person that can keep it, look at different ways that the person will express their grief. By the social factors that are at work about the individual, by the importance of the deceased in the system of the survivor's life, and by the value structure of the individual. Stage in the grief process, depression. This is a threatening enemy when loss comes. Think about a loved one, feel very lonely. The spouse may attempt suicide. The pastor can help to visit and speak about the departed loved one. They will possibly engage in experience of previous years. Okay? So, in other words, automatically your husband or your wife will be a real big torn apart. Okay? Because you lived for years together. Your children, depends on your family, what the situation are, all of that. Hey? Pining, this is a longing to relieve the past or spend long periods in time thinking about going to be with a loved one who has died. They are unable to make plans for the future because the future has no purpose for them. This is closely related to depression. Okay, next one, hostility. This is a part of the grieving process, but the expressing of anger that people have over the death of a person. This anger can be toward the doctors or nurses or undertaker and any other person who had something to do with the patient's last days of life. You're working with the patients, both of you sisters and stuff. You will a lot of time when yes, the doctor did this, and the doctor did that, if the doctor did that, and the nurse didn't do this, and the nurse didn't do that, then it wouldn't have happened, that type of thing. You most probably are, you know about that and things that's happening. You will hear about the mistake of the surgeons, the poor hospital care, and the part of the nurses, etc. The pastor should not try to defend these people, but simply recognize that this is their way of working through their own senses of loss. Don't try now and say to the person, no, but you know, defending that person. That is the way, a natural way a person goes through the emotions of a loss. Okay? The individual may be angry towards the one who died, abandonment from the spouse, and now she must alone raise the children. Ah, now he died. Now I must do this alone. I must, couldn't he just, you know, whatever the case may be. Inadequate preparations for the family were made, and there is difficult expression the anger towards the one because one who is now gone. Conflicts that were present in a marriage can cause a person to feel God is punishing him or her. That's never the case. God will not punish you by doing that. Okay? We do not have a punishing God. We've got to love God. It's all your own, all time. Your own doing, all time. You're getting old, you have to go. One other time. Children tend to feel guilty if they have been angry with the parent, then suddenly dies. That is guilt that's developing in that child. Right? You can help that person. Activity to those who share with him their inner weight. A parent again may feel that they did not do everything possible to prevent the death. The pastor must listen actively to those who share with him their inner feelings. He should not try to persuade them that they should not feel that way. Don't tell a person, oh, don't feel like that, but it's really not as if. That is a feeling the person had, and you must work through that feeling, work with the person through that feeling. Don't tell them, no, you really got it wrong. That is the feeling that's present, and you work with that feeling, and you work through that feeling with the person. Okay? And you're gonna, with pastoral care, you're gonna change the feeling of that person because of biblical stuff, things that you see that's different, and that will change the idea of the person. The best step is helping them to exteriorize their feeling. The pastor must make sure that they know that she accepts him or her with the negative feelings. If you've got negative feelings, don't push the person away. They've got negative feelings. Say, no man, you must be like this and this, and don't do that. Okay? Then you're going to lose the person. Guilt. Guilt normally comes immediately after anger, and this will come forth as the person is working through his or her grieving process. It's the same like a teenager is getting to an adult, growing up from a child, going to different processes, different psychological stages it's going through. That's the same sort of thing when you go through a grieving process. You will go through grieving, and then you're going maybe anger, maybe depression, and it's going through to anger, and then you know that's the way your brain is developing or reworking through everything, what's happening. Okay. Again, the pastor will not try to argue people out of their guilt feeling, but help them with it, to understand it. Okay. He will rather reply to them with empathy and indicate that she understands these feelings that are being expressed. Remember, if you talk about a thing, that's the way you put that thought through the cortex of your brain to get it through, to get it out of your system. He must follow closely the line of thinking, and she can point out things that the person did that represented interest, love, and care. That's what the person did. Okay? Acceptance of loss and reaffirmation of life. The final stage of grief is that of acceptance. The person realizes life continues, grief will file away the memories of the past relationships. He or she will move away from the sadness that has prevailed since the time of death. He and she will detach the emotional feeling from experience and loss. Future plans will be made excluding the departed one. The person may talk about moving to another house or city, embark upon a new business or social ventures. This is seen as therapy. They may begin to talk about the possibility of developing friendships with widows or widowers, find opportunities to meet new people, etc. Some will marry again, some not. Cultures may have different views of marrying again. Some cultures is if you pass away, you must marry immediately again, or you must help that person. Some will say, no, you don't marry again. It depends on what culture you're in. As the time goes by, normally a year, 2, 3 past, you will go on with life. Okay, you will realize that you went on with life, and your body will accept it. If it's a long time running, there's something wrong. Okay? There is not normal grief, there's something wrong. You must get help. There's a normal system the body goes through. If it's going to the abnormal grief, I'll just give you the abnormal grief examples of what's happening. If it's taking too long, and then there's problems. Okay? That is not supposed to take so long. You get your shock, you've got your stages, and go on. It can differ from person to person, but mustn't be prolonged with years and stuff. Then there's something wrong. Okay, now and again you feel sad. After years, sometimes I will. Even animals you get back. You've had, even with animals, you just think about what's a lovely animal it was, and you feel a bit, not nice what to say a person. There's sometimes that you will think back and things like that. I think that is normal, but if it's influencing your normal life, then it's not normal anymore, if it's over a long time. Okay? We will look at that. Acceptance of the loss occurs gradually, and the person will thank God for the relationship she had. Some make it final, decisive visit of the cemetery, and the cemetery is very near there. Every time I look at my work, okay, I've got to write it. Not a seminary, you're not going to visit a seminary. You go to a cemetery. Okay. It's just a thought that came. going through my mind. And they express their lost manifestations of grief. Grief work is said to be completed when a person renounces his longing for the lost person, accept the real words without the loved one, worlds without the loved one. Daily activities are engaged, and this year reaffirms that life is good and challenging and moves towards the future with the attitude of confidence. You will also know, I experienced it also, a person that's long time past, in the beginning you go to the grave to go and visit, and as time will go past, it's okay, a little bit longer, and then you realize after a while, well, it's going now long periods, that is as the brain works through it. You know, because you mustn't actually remember the person in the grave, you must remember the person when it's alive and when the person was dead. To sit every time by the person is not dead. You know what I'm saying? But that's the way we go through. Okay? Indications of abnormal grief. If grief is not over a period of 6 weeks to 1 year, there is a possibility that grief may become the vicious destroyer of the spirit. So if it's going too long, there's something wrong. Okay? We can say 6 weeks, we can say a little bit longer, person differ from person to person, but if it's going for a year, 2 years, then you will know there's something wrong. Okay? Yes, you will miss the person, definitely, and you will feel sometimes sad, but you mustn't let that influence your life anymore. Okay? Abnormal grief is when one refuses to recognize the loss, still prepares a place at the table at the mealtime, refuses to do away with clothing and other personal items, write letters to the deceased, acting as if they were off on the trip, go to the cemetery daily, sit and converse with the deceased, then you know there's something wrong. Talking all the time, you know, as a person, then there's something. Another abnormal grief is when a person quickly marries again. It is a good friend or of the deceased in order they can spend time in conversation about the person who has departed. They say normally that preferably do not marry within 2 years, remarry with after the person deceased. Preferably 2 years gap. Then you are clean. Okay? Because some people, that's just to make sure everything is a real thing. It's not just hanging on to another person. And then after a few years, I know about somebody that did that. After a few years, you realize, oh no, I went the wrong way. And then it's too late to marry. Okay? So preferably, they say 2 years gap before you remarry. And be careful that it's not just somebody you fell back on and a friend or something, as you see, and marry that person just because it's the same. That person knew your partner or whatever the case may be. Be careful of that, if it ever happens. He, she may look for something who physically resembles the one who has died, or one who is engaged in the same type of work. These are indications that the person has not worked through his grief adequately. Another is to become involved in a new business venture too quickly or make unwise risks. It's also telling you there's something not right. Okay? Directly after the passing away of the person. The grief reactions may be delayed for several months, and when a second person dies, there is an excessive expression of grief. In this case, the person is grieving over the first loss rather than the second. Sometimes Christians are erroneously told that they should not grieve if the loved one was a believer because they have gone to a better place. This serves to repress grief. Don't do it. Don't tell the person that. And will make future grief work necessary. Okay? So, with other words, do not say to the person, if you're a Christian, you know whoever is going to a better place. It doesn't change you as a person. You are human. You've got the right to grieve. If you look at Jesus Christ himself, he cried at the grave.
The Lazarus.
He cried, but he had the power to bring him back that we don't have. If he didn't cry, he didn't have any feelings on him, then he wasn't human, but he was human, and he showed. He's got grief, sadness, so why can't we do it? Even if he knew Lazarus was going to be in his palace, in his kingdom, he still grieved, he still cried. Okay? So there's no way that a person will feel or will have less grief if you think, okay, no, he's going to heaven, so now I'm fine. That is not, that's a good thought, but it will give you a little bit of peace, but it won't take the grief away. Don't say that. Just. Okay? Let the person rather himself or herself say it to you and then agree. Okay. Liederman mentions 9 alterations in the conduct of persons in grief which he calls distorted reactions. Overactivity without manifesting a sense of loss. The accusation of symptoms belonging to the illness of the deceased, a recognized medical disease of a psychosomatic nature such as ulcerative colitis, here we go with the words,
rheumatoid.
Yeah, thank you. Arthritis and asthma. Thank you for the for medical people here. An alteration in the relationship to friends and relatives. Furious hostility against specific persons, possibly the doctor or surgeon. Alterations of conduct that resembles psychoforensic proportions. Big words now. The lasting loss of patterns of social interaction, activities that are detrimental in one's social and economic existence, and agitated depression with tension, agitation, insomnia, feelings of worthlessness, bitter self-accusation, and obvious need for punishment. And there it is underlined. Abnormal grief, such persons may be dangerously suicide. Yeah. And that you must always take in account. If there's abnormal grief or something that's not right, you see this thing, refer the person to a registered psychologist or psychiatrist for medication, or to a GP, a general practitioner, that they can just help you or her with those symptoms, just for the time to go through. Okay? So, there's a lot of times that things like that happen that you must keep in contact. The minister's role with the bereaved. The opportunity to help. A person that is suffering a loss needs 6 to 12 hours of someone's time in order to talk through their loss and adjust anew. Refer more serious cases to a psychiatrist, because the psychiatrist is giving them medication. The psychologist will just also say, yeah, this is going on, and the person will also refer the person. Some psychiatrists won't just take either person. You need to go to a psychologist through a psychologist. Some just need to go through a general practitioner for a psychiatrist. Some, the general practitioner can maybe prescribe something, depends on the severeness of the case. Okay? A pastor should take initiative to minister. Although people may try to hide their feelings, you must not wait to be consulted. If it is difficult for the pastor to deal with people's sufferings or bereavement, he must carefully study his own emotional health, because he has latent problems that he's working through and needs to taking about his own difficulties regarding death and grief. If you went through something like this recently, and somebody comes with the same thing to you and you're still struggling, or it's years already and you're still struggling with something happening in your time as a pastor, then you must rather refer that person and go through your own work self. First look at yourself before you look at somebody else. First look, can you help the person before you help? In cases like this, the pastor will refuse to make hospital calls, make arrangements for the funeral by telephone, appear on the scenes just in time for the service, and disappear quickly as the service is completed. Then you know that pastor got something that's still bothering him or her. Okay? The funeral message, the pastor must make sure that through his sermon, he helps the people to face the reality of death and effects. Statements not appropriate. A lot of people say, "Oh no, he's not dead, he's just away for a time till Jesus comes." Don't do that. Okay? Nor identify that as the will of God. You do not do that. Because then the person will say, "But why did God allow that?" And the person can start blaming God. So don't do it. Don't say it. Just don't say it. Be with the person. Understand the person. Grieve with the person rather as going against the person. Be careful what you say. The objective of the funeral message is to offer comfort to the bereaved. It should be affirmation of our Christian beliefs in life after death, heaven, and eternity. The service need not to be long. It can also shortly refer to the life of the bereaved, and the reference should be truthful. And if the person did not live an exemplary life, no reference to this fact should be made. Don't lie over the pulpit, from the pulpit. Don't lie from there. If there's nothing to say, don't say it. Okay? Don't say something ugly. Just keep quiet. You know, as they say, you must know when to keep your mouth shut. You know, be careful what you say. Okay. The pastor will do with the quote abundantly from the Bible, using a passage which offer hope in the afterlife. The time of the funeral. The time following the funeral service will offer opportunities to the pastor to serve as counselor. You should show sympathy, interest, and understanding. The pastor could make statements that tend to sedate, calm the bereaved. It can be harmful to tell people to get busy, put their sorrows behind them, and face the future bravely. Again, don't try and put something else in the presence of a person. Or say, "No, man, keep yourself busy and you'll forget about it." No, allow the person to work through it. Again, I said again and again and again. Allow the person to work through it, to go through it, to experience the hurt, but it must be vocalized to her. Okay? Go through it. Phrases of following are not comforting. 6 months from now and you will feel differently. As I said just now, normally after a few years you will find out yourself you feel differently. But don't say it to the person. That's not going to work. You can actually make more damage. In time you will forget. As I said, you will feel different, but you don't say it. Or, she has not really died, you have not lost, but gained her. That's all to do, you know, a Christian, some pastors will say, "Don't worry, man, she was a believer, so she's safe," and you don't say that. That's it, what the person wants to hear. Even if he or she knows it, you don't say it. You don't say it. Okay? The counseling process will be stopped as soon as the person can go on, and everything discussed in the previous lesson about counseling also counts in this case. With other words, that which I discussed previously is exactly the same, there's no difference. And your assistant is actually walking with it, listen to the person. The main thing of counseling is listening, helping the person. Not trying to force him or her in a direction. He or she must turn him or herself into a direction. You don't do it through the pastor's mouth. Okay? Minister to those who threaten suicide. Who attempts suicide? those in recent bereavement. There is a higher attempt of suicide among those who are lost a parent or spouse within the previous 2 years. Also, there are 5 times as many suicide attempts among those who are experiencing grief than among the population in general. One of the reasons for this is the lack of support systems to help. Therefore, the pastor and church people must be more aggressively helping those who are in grief. There, the 2-year period is given. Okay? So, if you remarry or whatever after 2 years, preferably. As I say, again, you can differ from person to person. After this, those parents have divorced. Suicide among teenagers in the second most frequent case of violent death in young people where their parents are divorced, because it creates so much turmoil in some of them that they see no purpose in continuing to live. Those with certain personality traits, certain personality characteristics that which seem to indicate a greater tendency to attempt suicide. We will look at those. The obsessive personality is one whose world has no function in a very ordered manner. It does not tend to be unable to cope. If there's no definite order, there's a problem. Okay? Then that person is difficult to cope. The person with a history of emotional depression often attempts to suicide. This person lives with a dark cloud of hopelessness over him or her, which tends to follow him wherever he goes. Someday he may act out his feelings by attempting to end it all. So look at those personalities. The other attempts suicide because of extreme feelings of love or hate towards another. You get, when a person is a little bit hanging too heavy to a side, then you must realize there's something wrong. Depression in grieving is normal, but it's going, there's a bracket where, this is going too far. If there's something going on, the reason why the person passed away was, then, there can be a little bit of a longer time, because there's things constantly pouring out a person's emotions. That's a little bit different. Okay? If I may, like in murder cases, there's court cases, things coming, and that's calling up every time the person, you don't get a chance to work through it. That's a little bit different. Okay? You must understand, as I say, a person, like person, what the case is, how long it will take. Although this is just the normal statistics that they give us. There's a normal death that's going on. But it can vary from person to person. But if it's extremely long, then there's something wrong. Facts and fables about suicide. Facts and fables regarding a suicide person. There's a common saying that those who talk about killing themselves will never do it. Please, if somebody tells you, I feel like taking my life, anything, you react. You don't leave that person. Facts show that 8 out of 10 persons who commit suicide have given clues or warnings about their plans. Therefore, we should take the threat as something serious. Be careful. Don't just leave it. Okay? The suicidal person is gambling with death in hopes that someone will hear their cry for help. That is the emotion. Please help me. I don't know how to say it. I've got sore, but just please help me. It's a cry for help. And that is where, if there's suicide attempts or suicidal thoughts, you go to help that person. Okay? They really rely so not want. They really so not want to die. That's not really inside them, but the hopelessness in the person is so great that at the end they step over. I don't know how true the fact is, but witnessing some cases. I know that when you get into a suicidal attempt, then normally they say the brain is not functioning at that moment normally. So you don't really, at that specific moment, are truly in control. So, preferably before someone will take a note, write it down before then already the brain is acting out. So, listen when there's any threats, you listen to it. People get over being suicidal. When the crisis has passed, they tend to readjust just to life and move forward with purpose. Remember now we're talking about grief, not normal situations. Grief. Therefore, our task is to help them to get over the immediate crisis which they are facing. Suicide is not more frequent among the rich than the poor. Studies show that people from all social economics levels attempt to take their lives, so there's no difference. Okay? The tendency to contemplate suicide is not inherent, as some tend to believe. Yeah, your mother took their life, so you will take it. It's not so. It's not true. But what I know they say that can carry forward, they say depression, there's a possibility of coming down your descendants' DNA. How much is true? I'm not a scientist, I don't know. But I believe that what I read already through the time of my thesis and everything, that you can get that what would I say? I can't call it not a disturbance, not a disorder. We don't call it disorder, we call it a disturbance. It can disturb, but it's not to say you will have it. As a psychologist always say it's a disturbance, I would rather say it's a disorder, I would rather say it's a disturbance. It can disturb you, but I don't think personally that it's a disorder. That is what they call it. Okay? That's my opinion. Okay? There are cases in which various members of family will attempt suicide, but that does not mean that it is an illness or something inherited within the family. The one who attempts suicide is not necessarily mentally ill. Studies of suicide notes indicate that most persons who attempt suicide are genuinely unhappy, but not necessarily mentally ill. And unhappiness can really take over your life. That is why you've got your partner or a good friend or whatever, a female friend or something that you can talk to, that you can lean on. A person you can lean on. Okay? That's only to help you through that. So it's unhappiness. Okay? That is what the studies say, that the suicidal attempt is normally unhappiness. Pastoral care to the suicidal person, be alert to signals, any signal which might indicate that the person is contemplating taking his own life. The person is usually not hesitant to talk about his thoughts. He will share his inner turmoil with the hope that the person will intervene in some way to prevent his attempt. So you must sort of read the person and listen very carefully to a person. People usually want someone to stop them. That is what their desire is. Stop me, I'm going to do it. Help me, or I do it. Okay? English and Pearson make this observation about suicidal thoughts. That's also in your manual. While he, the patient, may occasionally have them and conceal them. Generally, he is quite frank about them, and welcomes both an opportunity to talk about them and to seek attention from them. It is not harmful to speak about suicide, for discussion does not condone the idea, nor does it shock or hurt the pride of the person. If the question is asked calmly in matter of factly along with others, it has no special significance beyond a rational seeking of information. There is there's nothing wrong with the person. That does not degrade a person. It does not anything if you got that type of thought or feeling. As I said earlier, in the rich as well as the poor, all over the society it happens. That is a human thing, and it's actually happening more and more in these days because of our economic stages and hunger and all of that. And keep that in mind to help that person emotionally. Okay? It's an emotional thing. Offer personal care with empathy. When visiting members and prospective members of the church, they may hear signals which persons give. Follow up. Frustration can cause a person to contemplate suicide. The counsellor must respond in an open manner without appearing to be shocked. Don't, what do you want to do? There must be something natural. Why you want to do that? Help the person through it. Okay? This will give the person more opportunity to vent his feelings. If the counsellor acts with the idea that his thought is scandalous or a grave sin, then the person will probably refrain from giving an additional detail about his feelings or plans. You may not take your own life, you may make suicide because it's sin. It's killing. Automatically the person is not going to say anything. Isn't that so? But if you open up, there's a problem, that it's possible that you feel like that, come and look at it. Do you have that attempt? Be calm, be understanding, care for the person. What would Jesus do? What would Jesus do? Will he attack the person or will he try to help the person? You've got that feeling, come we look at it. Because it's human and we get attacked. We've got sin in our lives and all of our lives. So you can't say, no, you can't do it, because then the pastor is also guilty because he also got sin. He or she. Don't attack the person. Help the person. Okay? Help the person. Give positive reassurance that is realistic. Do not reassure without some hope of being able to help the one who is facing the crisis. Every person needs to emergency fund to use when people are needy. That is a great thing we do not have in South Africa. Very, very few churches that will do that. Am I right or am I wrong? There's people that's needy, need food, needs assistance. There's a very great lack of that. I think it's all over the world now. A very big lack. The past is normally the source of hope, and when the spiritual resources are appropriate, do not hesitate to read more portion of the Bible and pray. You should offer to make contact with friends and relatives to encourage them to give their time and attention to the person until he gets through the immediate problems. Special groups in the church can visit and minister to people. That's a very great lack in our society. Maybe in the richer churches, I don't know. In the rich churches, they got maybe psychologists and all those people that the more poorer churches can't afford. I can't say, but the amount of rich churches in comparison with the poor churches, I think is quite a big difference. Okay. Make referrals when needed. Remember, I said a few times, refer the person if it's needed. At times it will be necessary to refer the person to a psychiatrist or mental health agency that possibly will assist the situation. If no friends or relatives are near, refer the individual. If necessary, look for a charity agency in the community. There's, as I say again, in the back of the papers I gave you, the full list that I gave to you in Western Cape that you can look at. Okay? What to do in cases of an actual suicide? A pastor must minister to the family members of the one who took his or her life. Understand it. Okay, minister to that person. These people would have appeared to be the people least likely to commit suicide and may have given no indication of distress. The survivors may have to deal with their own emotions. Okay? Why did the person take their own life? What all that guilt feelings, all of that thing? Surprise, shame, shock, guilt, and anger may be may all be mixed together and can only come out weeks later. Therefore, several hours of the pastor's time will be needed in order to adjust. A layman can also be called in to help. A pastor should encourage the members of the family to face their pain openly and not try to hide the truth. Concealing information of this nature will cause a negative effect. It is better to promote mental and spiritual health by admitting and facing openly what has happened. There may be intense guilt feelings about their failures towards the one who took his life. They may have intense anger which limits their effectiveness in the work which they do. Pastoral care will help them to get peace with themselves and the deceased. The pastor must just be willing to listen and respond empathetically to those who share the guilt and anger. Sympathetic. Ministering to the terminally ill and uncertain future. When the situation appears hopeless, the physician usually shares the truth and suggests the best procedure for facing an uncertain future. Reactions of those who had terminal illness? Denial. They will say, they don't believe it. Can't be true. Okay? This is not really happening to me. They've got the reports confused with those of someone else. They will talk about the young age and their relatives have all lived beyond 70. They might even go to another doctor in another city and have more tests done. Is this true? Can it be true? Can't be true? Okay, that is denial. You don't accept it. Okay, that's denial. Anger. The person may become angry with God, their families, their doctors, their work, and others. And they so like to get angry with God. Right? That we hear a lot of times. They feel God has treated them unjustly. What a safe face is like. We felt that God had given us a bad deal when we first learned that my husband had an incurable illness. Or they say, they may lash out against the doctor for not finding out about the problem sooner. Why couldn't this have happened to someone else? Why to me? That we hear a lot, eh? They feel that they have much yet to get done in life. They are uncooperative with the nursing staff. They resent the fact that they have lost autonomy over their own bodies. We don't have control over our own bodies in any way. If you must be sick, if God wants to, if Satan's going to put an illness or whatever the case may be, you can't stop it. You can some sickness you can cure, but if you're going to get it, you're going to get it. The pastor and Christian leaders need to understand what is happening to the patient. He must be in the acceptance of their angry feelings. If there is none, he possibly repressed it while the pastor is in the room and is angry and upset when others are not present. That is happening. Suppression of feeling when the other person is present. Okay? And that will most probably happen a lot specifically when there is a pastor present. Okay? Bargaining. The person recognizes the sickness is real and begins to bargain with God, asking for additional time. Yeah, if you give me this, my God, or I give you this, stop this and this, will you please let me live longer, whatever the case may be. Okay? To stay alive till a significant goal has been reached, then you will set another goal when the one is reached. So say for example, I will stop drink alcohol, then I will give my life to you, God. So okay, say for instance, he's getting healed for that specific sickness, and he's giving his life to God. Now something else happened. No, God, you know, if you do this for me, I will again do this for you. You know, another goal. Okay? The person will express happiness that the issue is still around and will talk about the immediate goal that is before him or her. They will learn to live with their problem and talk about it, and they realize that they must make the most of time that they have. A greater intimacy in their marriage and in other relationships is present. They may want to talk with the pastor about spiritual concerns, which are the great significance to them, now that they realize that their time is short. Depression. We all know of depression, I think. Depression will be present, and as the disease progresses, the person sees that there is a little or no hope, and he or she wakens physically. The depression deepens. The person realizes a great deal of money is being spent for treatment, the medical and burial expenses. He or she will never return to work. Many goes are lost, and he or she sleeps a great deal of the time. Visitors are not important as before, and he or she has little desire to talk. The pastor must take the initiative to talk about what is happening in the church and among the people in the community. A short scripture and a brief prayer are welcome. The pastor must meet them where they are emotionally, and not try to cheer them up. Rather respond to them in a warm, friendly manner and assure them of your love and concern for them and their family members. Acceptance. They reach a stage in which they accept their illness and the fact that their line is short. They become more fragrant, calm. They will lose strength, lose consciousness, sleep more. Sometimes they request that no visitors come to see them. Adults ask that their children must no longer visit them and express very little emotion. Hope. Hope is present for the first time. The patient will try out all sorts of treatment and put a lot of hope in new forms of treatments. Some try and believe that God is going to heal them. At times the patient will experience remission because of some treatment. Hope is an important element of their lives and encourage people to have hope and trust in God's power to heal. As pastors, we are agents of hope. We can quote the passage from the Bible that encourage us to have hope. Now, we do know, or what does happen is when a person is very old already, sometimes they just lose hope and just give up. And they pass us. But if it's a young person with suddenly, then it's difficult for that person to accept it. There's a little bit of a difference. Okay. Let me look at passages. Romans 5 verse 2. Through whom also we have had our access by faith into the grace wherein we stand, and let us rejoice in hope of the glory of God. 1 Timothy 1 verse 3. Remembering without ceasing your work of faith and labor and love and patience of hope in our Lord Jesus Christ before our God and Father, in hope of eternal life, which God who cannot lie promises before time is eternal. Blessed be the God and Father of our Lord Jesus Christ, who according to his great mercy begot us again unto the living hope of the resurrection of Jesus Christ from the dead. Slaan my oë op na die berge, waar gaan my hulp vandaan kom? My hulp is in die naam van die Vader wat hemel en aarde geskaap het, en wat nooit laat vaar die werke van sy hande nie. That's the Afrikaans. I think that's the enige that got that, what was I saying? But that's true. That's a fact. Okay? Pastoral care to the terminally ill. The care to the terminally ill will respond to the patient from his or her frame of reference, depending upon where they are in the particular stage of their lives. Supportive listening, that's very important. Listen to the person. They want to open their hearts and tell the pastor things which they have hidden from everyone else. That's normally coming out at the end. Right? There must be a time of confession of sin, want to know more about God, death and the afterlife, have fears, worried about the spouse or their children. The pastor will respond to the person depending upon where he is in his or her thinking and in his pilgrimage. The pastor must avoid going to the sick room with their own agenda at any time. You know, I'm going to visit this person, I'm going to do this and this and this. You're going to react on the person's reaction, okay? But especially as he ministers to those who are dying, feel free to talk with people about their faith. Most people will be anxious to clarify any questions or doubts that they have. He can affirm the faith which he sees and hears in the expression with which the patient makes. He can talk quietly with them about their need to trust in Christ and face the unseen future. The pastor should accept this invitation, but he should be careful not to act as if God can intervene and change the medical diagnosis. He or she should not offer divine cure, nor should he or she be fatalistic and act as if the situation is hopeless. He or she can assure the people of his concern for them and his willingness to come and minister to them from time to time. It is appropriate to pray quietly with the family and ask for God's help in this situation.